Hi, I'm Abby. I'm one of the veterinary technicians here at Grady Veterinary Hospital. This is Guinness. He's one of our clinic cats. Today I'm going to talk to you kind of about just three common things that we see here. I work the emergency night shift, so there are many different things that we see animals come in for. The first thing that we see is vomiting and diarrhea. We tend to see this pretty much every night in the emergency room. Vomiting and diarrhea can be caused by several different things. It can be caused by either if your pet has eaten something that is upsetting their stomach, if they've gotten into something toxic, different viruses that they can carry. So a lot of the times when your pet comes in, we like to start by doing a fecal, and this can test for any intestinal parasites that your pet may have. If your pet does come in for vomiting and diarrhea, a lot of the times we also like to take an x-ray of them so we can see into their abdomen, see if their intestines look funny, or if there's anything stuck in there, like sometimes dogs eat foreign bodies like toys that can cause vomiting. If your pet is presented for vomiting and diarrhea, sometimes they will have to stay in hospital. We do like to put them on IV fluids if necessary. We also give them medications to help control their vomiting and diarrhea. Sometimes if the doctor feels that the case is not very severe, we are able to send your pet home. And a lot of the times in this case, we like to do fluids under the skin so your pet stays nice and hydrated. And also, a lot of the times we'll give them an injection of a medication that helps to control their vomiting and diarrhea, as well as send them home with like oral antibiotics and oral medications to help control it as well. The important thing to remember with vomiting and diarrhea is that you don't want to let it go very long because it can dehydrate your pet very quickly, especially little puppies and kittens and very small dogs. So if you start to see your pet have vomiting and diarrhea, the best thing to do is to give us a call, and we can tell you, we can recommend what to do. It's very important if your pet is having seizures, you do not want to let them go to where they have multiple seizures at once. So if you're concerned, I think the very best thing to do is to give us a call if you're afraid that your pet is having a seizure at home, and we can further direct you what to do. Sometimes also when animals have seizures, they can be very aggressive. So it's very important to take your own safety into consideration. Also make sure your pet, if they're having a seizure at home, is not around anything where they can hurt themselves. They're not by stairs where they could potentially fall down, or they're not by furniture where they could hit their head and potentially cause trauma to themselves. If your pet is having seizures, sometimes we do recommend that you keep them in hospital overnight. That way we can place an IV catheter and administer any medications that we need to stop their seizures. The third big thing that we see is kind of just any trauma case in general. A big one is when pets come in and they've been hit by a car. It's very important to bring your pet in when they have been hit by a car, even if you don't see any major injury, because sometimes their injuries can be internal. And a lot of the times, if you don't address it sooner, it can get later, or it can get worse later. So it's very important to bring them in. A lot of the times we'll like to take an x-ray, make sure everything is okay in the chest and abdomen, make sure there aren't any broken bones. If there are broken bones, we like to address those right away. A lot of the times we'll put a splint on them to stabilize the bone, and sometimes pets then later need surgery. Another big trauma that we see here in the emergency room is when big dogs and little dogs get into fights, and it causes lacerations, and we have to kind of go in and repair those. Sometimes they're very small cuts and we're able to just kind of staple them up, and other times they're more invasive. But it's very important to bring them in, bring your pet in sooner than later so we can address those. The quicker they get addressed, the better they'll heal up, and the less potential your pet has to get an infection. So a lot of times we like to clip those wounds up and clean them. Sometimes your pet can go home the very same day if it's not very invasive. We typically like to put them on some pain medications and an antibiotic, and they usually heal up pretty nice.